Chikungunya is a condition that will circulate throughout the population and will become endemic in Jamaica. So from here on, chikungunya will be in Jamaica. So there is no public health system that can contain and prevent the spread of a virus like chikungunya as it is carried by the Aedes aegypti mosquito. So in order to rid yourself of chikungunya, you would have to be able to rid yourself of the Aedes mosquito, and that has not been successful in any jurisdiction. It is true that an organism can become resistant to a particular chemical. As you know, we had a malaria outbreak in 2006, and we used a particular chemical, mostly malathion, during those times. What we have to do to prevent the sustained resistance in the mosquito population is to alternate the chemical that we use. So we don't always use malathion in doing the fogging activity. I will tell you, though, that the fogging is really not the most effective means of controlling the mosquito population, and what is more effective is to reduce, destroy, and prevent breeding sites for the mosquito by getting rid of any space, any water that the mosquito can lay eggs in. There has been additional resources provided, but as I said, we have what's called an integrated vector control program, which targetedly and sustainably fights the vector that can carry chikungunya. Remember too that it's the same vector that carries the dengue virus, and hence you would have seen we have had sustained activity since our last outbreak of dengue in 2010. Ebola is a very serious condition, very, very serious. And unlike chikungunya and dengue, where the death rate in chikungunya, for example, is less than 1% of those infected, and for dengue, it may be around 5%, between 1 and 10% of those infected. For Ebola, up to 90% of those who are infected will die. In this outbreak, about 50% of those infected have died. And funny, more than 50% of the healthcare workers in close contact with these cases can die from Ebola. So you can imagine it's an illness which needs intense treatment and management, but the persons who are most at risk are the persons who are taking care of you. So family members are particularly at risk, healthcare workers, if you do not use the appropriate protective equipment. In terms of Jamaica, we have a surveillance system, and we would be able to detect a case of Ebola. The management of Ebola requires strict isolation of any case and to prevent contact. The equipment that you require in terms of the protective gear are available here, and we do have them. So we could, manage a couple of cases. If we were to have an extended outbreak of Ebola in the country, it would be challenging and would certainly be a public health emergency that would require significant assistance from our partners. What we would want to see is an environment where you could provide the appropriate services and discussions around anal sex and the risk that it brings with it, and to facilitate the use of supplies that would reduce that risk. Repealing the law alone will not improve the environment. As I'm saying, what is required is an appropriate educational program to speak about anal sex. What is it? Why is it at a high risk? And to be able to provide the necessary services for those engaged in that practice to have a safer anal sex or to reduce the practice if that is their desire. What I will say is that for all persons should have free access to the health services regardless of their sexual orientation or practices. And for us, we do not ask your sexual orientation to provide service. So everyone can access services within our health facility. What I'm saying is for us, we provide the service to all Jamaicans regardless of their sexual practice and orientation.